All right, let's talk about magnesium. You hear about it everywhere, and honestly, for good reason. It's an absolute powerhouse mineral that's involved in, get this, over 300 different reactions inside our bodies. We're talking everything from creating energy to making sure your nerves work right. It's critical. But there's always a but, isn't there? Here's the crazy part. A staggering number of us might be running on empty. Some research points to the idea that up to 80% of people just aren't getting enough of this mineral. I mean, think about that. That's a huge chunk of the population who could be feeling the effects of being low on magnesium.
So, your first thought is probably, okay, I'll just grab a supplement. And that makes sense, but you really need to pump the brakes. Because while magnesium can be a game changer for your health, taking it the wrong way, well, it can be seriously dangerous. We're talking risks like major kidney problems or even messing with your heart. So today, we are going to break it all down, who really needs it, who absolutely must avoid it, and the right way to use it safely.
So let's start with the basics. How in the world do you even know if you're in that 80%? Well, luckily, your body has a way of sending up some pretty clear flares. Let's get into what you should be looking for.
Okay, think of magnesium as the ultimate chill pill for your nerves and muscles. It tells them to relax. When you don't have enough, your nerves kind of go haywire. They get overexcited. And that's when you get those awful, sharp calf cramps in the middle of the night or that super annoying eyelid twitch that just won't quit. And since it's also crucial for muscle energy, just feeling weak all over can be a big red flag.
Now here's the connection that blows a lot of people's minds. You know that feeling of being constantly on edge, anxious, or when your mind is just racing a mile a minute when you're trying to sleep? It might not just be a stressful day. See, stress actually burns through your body's magnesium reserves. And here's the kicker. Having low magnesium makes you feel even more stressed. It's a nasty, vicious cycle.
And this slide just lays it out perfectly. You feel stressed, right? So your body goes into overdrive and uses up more magnesium to handle it. Then the stress hormones themselves, like cortisol, actually make you pee out magnesium faster. So now you're even lower, which makes your body's stress response even stronger. It's like being stuck in quicksand. The more you struggle, the faster you sink.
And beyond just those general signs, some of us are just naturally at a higher risk. As you get older, your body just isn't as good at absorbing nutrients, including magnesium. If you have digestive problems like IBS, you're not absorbing it well either. Diabetes can cause your body to flush out magnesium. And yeah, if you're a regular drinker or you sweat a ton, say you're an athlete, you're constantly losing this essential mineral.
Okay, I really need you to listen closely to this next part. We have to get serious for a minute. For all the amazing things magnesium does, taking a supplement is not for everyone, and for some people, it can be straight up dangerous.
This is probably the most critical warning. Your kidneys are like the filter for your body. One of their biggest jobs is to get rid of any excess magnesium you don't need. So if your kidneys aren't working at 100%, even a normal dose from a supplement can build up and become toxic. It's a condition called hypermagnesemia, and it can lead to nausea, weakness, and in really bad cases, it can actually stop your heart.
And this isn't just a theory. Take Margaret, a 72-year-old woman who had what she thought was just mild kidney disease. Her doctor suggested magnesium for constipation, a really common piece of advice. But our kidneys just couldn't keep up. In just 5 days, she was exhausted, nauseous, and ended up in the hospital. A simple over-the-counter supplement caused a full-blown medical emergency.
Remember how magnesium is a natural relaxer? Well, that applies to the muscles in the walls of your blood vessels too. For people with high blood pressure, that's great news. But if your blood pressure is already on the low side, taking extra magnesium can cause it to drop to a dangerous level. We're talking dizziness, fainting, and a serious risk of falling.
This is exactly what happened to a guy named Robert. He was 69, and his blood pressure was always a little low. He started taking magnesium for muscle cramps, and just 3 days in, he stood up from his chair and the entire room started spinning. He almost fell flat on his face. Turns out, his blood pressure had absolutely plummeted. His doctor told him to stop the magnesium, like yesterday.
Your heart has its own electrical system, and magnesium plays a big role in keeping that rhythm steady. But if your heart rate is already naturally slow, a condition called bradycardia, or if you have something like a heart block, taking extra magnesium can slow those electrical signals down even more. It can make a pre-existing condition much, much worse.
Just listen to Frank's story. He was 75, and his resting heart rate was usually around 55 beats per minute, which is slow but was normal for him. He started taking magnesium to help him sleep better. But within a week, he just felt incredibly weak, so he went to his doctor and they found his heart rate had dropped all the way down to 42.
the magnesium was literally putting the brakes on his already slow heart.
So it's not just about health conditions you already have. Another huge danger zone that way too many people just don't think about is how magnesium can interact with medications you're already taking.
Let's see how this actually works in the real world. So with certain antibiotics, for instance, magnesium can literally grab onto the drug in your stomach and prevent your body from absorbing it. There was a woman named Linda who kept taking her magnesium supplement with her antibiotic every morning. Her infection just wouldn't go away. It wasn't until a pharmacist put 2 and 2 together that they realized the magnesium was making her antibiotic completely useless.
Okay, I know that was a lot of scary warnings. So now for the good news. If you and your doctor agree that magnesium is right for you, there are absolutely ways to take it safely and effectively. So let's go over the rules.
First things first, you gotta know that not all magnesium is the same. The type listed on the bottle is a huge deal. What you really want to look for are forms like magnesium glycinate or malate. They're what's called chelated, which is just a fancy way of saying they're attached to an amino acid. This makes them way easier for your body to absorb, and they're really gentle on your stomach. On the flip side, you've got magnesium oxide. It's everywhere, and it's cheap, but your body barely absorbs it. For most people, it just ends up working as a laxative.
Now, how do you actually start? The absolute golden rule here is start low and go slow. Please, don't just grab a bottle and pop the highest dose you can find. Begin with a small dose, maybe just 100 milligrams a day, and always take it with food. Dinner's a great time. This really helps your body absorb it and keeps your stomach happy. Just do that for a week, see how your body feels. If everything's cool, then you can slowly think about increasing it, maybe splitting the dose between morning and night.
And finally, let's wrap up with 3 more super important rules. 1. If you're taking a calcium supplement, you need to balance it with magnesium. 2. Don't put all your faith in a blood test. It sounds weird, but only about 1% of your body's magnesium is actually in your blood. So those tests can be really misleading. Pay more attention to your symptoms. And 3. Remember that your diet matters. Things like caffeine and alcohol are constantly working to drain your magnesium levels. So here's the bottom line. Magnesium is incredibly powerful, and for many of us, essential. But it's not something to be taken lightly. It absolutely demands respect. So after hearing all this, you have to ask yourself the question, is the supplement you're taking really helping you, or could it be silently hurting you? Now you have the information to find out.